Good afternoon and welcome to LAHMA's program on COVID awareness. I'm Deborah Kennedy, President of LAHMA. Although we all thought earlier this year that COVID would come and go in mere months, we all now realize that we have to deal with it and we'll be dealing with it for some time to come. We need to learn how to live with COVID and still maintain our businesses and properties. We hope this program will provide a review of what we have done, some positives and some not so positive. We also hope to strive to better understand this disease so we can be more proactive and responsive. The LAHMA board has assembled a panel of experts to answer your questions and assist you as you plan for the future. LAHMA is happy to provide this program, and we thank you for being with us. I'll now turn the program over to our moderator, Norman Robinson, so we can get started.
Thank you, Deborah Kennedy. I'm Norman Robinson, and indeed, welcome to the Louisiana Affordable Housing Management Association seminar for 2020, COVID Awareness Past and Future. As you know, COVID-19 has affected every nation in the world, and specifically here in the United States, we have experienced overwhelming unemployment, homelessness, physical and emotional ailments, and tragically, over 240,000 deaths to this date. In today's seminar, however, we will discuss what has happened and what we can expect to occur as a result of COVID-19. Before we do that, though, let's meet our panel of experts, beginning with Ms. Sarah Babcock. Ms. Babcock is the Director of Healthy Environments and Communications at the New Orleans Health Department. She received her Bachelor of Science from Elon University in 2009, followed by her master's degree in International Public Health from Tulane University School of Public Health and Tropical Medicine in 2011. And Dr. Julio Figueroa. Dr. Figueroa is a professor of medicine and chief of the section of infectious diseases at LSU Health New Orleans School of Medicine. He joined the infectious diseases faculty at LSU Health New Orleans School of Medicine in 1993 and became the educational program director for the section in 1996. Dr. Figueroa also serves as medical director of infectious diseases at both Touro Infirmary and Ochsner Medical Center in Kenner, Louisiana. He is also the lead physician for the antimicrobial stewardship and infection prevention programs at LCMC Health. Also joining us via Zoom from Washington, D.C. is Ms. Chris Cook, Executive Director of the National Affordable Housing Management Association. Ms. Cook joined the association as its Executive Director in November 2002. The National Affordable Housing Management Association is the leading voice for affordable housing management, advocating on behalf of multi-property managers and owners whose mission is to provide quality affordable housing. Ladies and gentlemen, welcome to today's seminar. And we want to remind you, those of you who are joining us via the internet and on this webinar, to ask questions that you feel might be relevant in helping you navigate this particular epidemic that we are all faced with at the moment. We will begin our questions related to the housing industry, because most of you are dealing with COVID and what you should be doing about your tenants and your managers and your administrative staff as it relates to providing some kind of safety protocol for this this infectious disease that we're all dealing with. Let's start with Ms. Babcock. We talk about COVID, past and future. Where are we in the past and where are we going in the future?
Sure. Well, thank you for having me here today.
Yeah, you're welcome.
So COVID-19, obviously, this is a new novel virus that we've all been dealing with. And so we are about 10 months in to this virus. And really, you know, the first few months was learning a lot about it, how it spread, what happens. I think we're still learning that, particularly around some of the long-term health outcomes people may have if they've had a COVID-19 infection. And particularly here in New Orleans and Louisiana, we obviously had one of the very early spikes in the country. So we have taken a lot of measures over the past 10 months to make sure that we're protecting people, we're keeping our case rates down. And so we've had a good 9-10 months of real life experience helping prepare our hospital systems, our healthcare providers, and also our residents for this. But we are nowhere near the end. And so we still have a future. We are starting to enter the winter months, which, experts have told us for a while now, we would likely see a spike. We're seeing that all over the country and the world. And over the past week or two, we're starting to see Louisiana follow those trends. So I think we are not out of the woods. And we're really now, the next phase of this is really looking at a vaccine. So we're hoping that over the next few weeks or months, a vaccine will become available. We're starting to plan out what that looks like. And then what happens policy-wise once a vaccine has been adequately distributed, right? When can we start taking off masks? When can we start gathering with friends and family again? When will it become a little safer? And some things we're still unsure about, but it's starting to look like maybe this is going to be an ongoing thing. Maybe this is our new version of the flu where it comes every year and never really leaves us. So there's still a lot we're learning, and I think we're pretty, right in the center of this disease.
Dr. Figueroa, you're in the hospital, so you see this close up, a close encounter, if you were, for lack of a better word. So what is your perspective then on where we're going as opposed to where we've been?
So initially, as was mentioned, we had a big spike in March, April. The hospitals were definitely seeing very sick patients, and a lot of them. Many of the hospitals had to shift resources towards taking care of these patients. They had to shut down a lot of the routine types of procedures, elective procedures that would ordinarily have been taken care of, but couldn't be taken care of because a lot of resources were being generated towards taking care of COVID-19 patients. We sort of got over that hump, and over in the summer and in the fall, we've been sort of running as usual in terms of the hospital capacity, and that's in large part to the work that's been done by the health department here and by the state, and by doing mask mandates and doing the testing and all those sorts of things that are very important in terms of maintaining what's going on. We're seeing a little bit of an increase here recently, and that's probably related to factors as was mentioned. People getting together for holidays, Halloween's big here in New Orleans, other types of events. We're going into the holiday season, and so that we're thinking about how we're going to manage our encounters in both in the community but also in the hospitals as these folks come in. And
we know that the COVID-19 pandemic is especially problematic for people in densely populated areas.
Absolutely.
And we're dealing with officials in the housing industry, especially people who have a lot of complexes, multi-unit complexes where there are a lot of tenants. So what is their concern at the moment? How should they approach dealing with keeping their properties and their clients and their tenants safe?
So, from my perspective as an infectious disease doctor, it's really to try to minimize risk with all the encounters that are occurring inside your building. So that mask wearing is going to be very important, because control of secretions and of aerosols using proper masking at all times, or as much as you can possibly do, is going to minimize the amount of exposure that your other tenants are going to have. So I think that's very important to keep in mind. The other aspects are related to ventilation and those sorts of things. So good ventilation systems are also been shown to be important in controlling this virus. And then in the common areas, that would be the other thing. So that a lot of the hospitals, for example, have gone to all their rooms and said the maximum capacity for this room is X, whatever it happens to be, based upon the people who are air scientists, environmental scientists, those sorts of things. So maintaining those kinds of standards in your common areas are going to be very important to do as well. So elevators are an example of that, but also, you know, party rooms and things of that nature would also have to be considered.
Ms. Cook, from a regulatory perspective, as the director of the National Affordable Housing Management Association, what is your protocol for telling the people that you are associated with? What is your protocol for them as it relates to staying safe during this epidemic?
Great, thank you, and thank you for having me with you today and hosting this session. So NAHMA, as a voluntary nonprofit trade association representing property management companies, we track the regulatory guidance issued by the Department of Urban Development, HUD, Housing and Urban Development, as well as rural development for rural properties, and then whatever IRS puts out for tax credit housing. And generally, the specific regulatory requirements, if we focus on HUD housing, has been delivered through a series of frequently asked questions that the department has posted to its website. And that document and lots of other regulatory guidance has come out since March, as well as rural development and IRS in many states. Generally, the guidance focuses on following CDC guidelines, but also state and local guidelines. There are many counties, even at the county level across the country, where there are, say, eviction bans or mask mandates. So it's very much at this current time, a locally driven solutions approach. NAHMA, as a national organization, we host a weekly meeting for our executive council. And so members, property management companies from around the country join every Friday and share their best practices and ideas and questions for dealing with their properties and keeping everybody safe. From a regulatory point of view, there are overarching requirements that remain in place, such as fair housing, and there's obviously other federal law approaches that protect privacy, such as the American Disabilities Act and Health Privacy Acts. So very much following guidance on social distancing, but requiring masks depends on your state and local requirements. It can be perhaps made part of your house rules, but again, it's going to be very much driven through acceptance and HUD's approval process and by what's going on locally from a regulatory and legal approach at any kind of local government level.
So this sounds like a hodgepodge approach to dealing with any kind of safety precautions. What do you tell somebody from, say, Nashville, Tennessee, an owner of a multi-complex who's calling you for advice, Ms. Cook?
So the first thing we ask them to check is with their local health department to see what the any local requirements are regarding mask requirements or other limitations on attendance, quarantine if you've been visiting other places. And unfortunately, that is the reality today in the United States, that it is a hodgepodge of response to the virus. In the DC area where I am, we've had a variety of county executives of Prince George's County, Montgomery County, these are Maryland counties, issuing just yesterday new shutdown requirements or restrictions based on the virus in their county. But the reality is the virus doesn't know county limits. It's very much where people move. And so you're absolutely right in your characterization of it as a hodgepodge, but at this point, we are left with that as our response mechanism.
Taking note of this hodgepodge approach that we seem to be taking across the nation, depending on what region of the nation you live in, we know that many of you watching this program are from various areas of the country. So you might have some specific questions about your particular concern for the medical experts and the housing regulatory agency expert in the audience. So we encourage you to ask those questions or submit those questions to us, and we will then relay the questions on to our panelists. Let's get some industry questions covered right now. And the first industry question I want to cover, and starting with Ms. Babcock, is that many multifamily properties have a variety of tenant age groups. Should we exercise different precautions for different groups, such as the elderly?
Sure, it's a very good question. What we know of COVID-19 is that the elderly and people with some pre-existing conditions, diabetes, heart disease, for example, are going to may have more severe health outcomes. And but we know that all age groups are able to get COVID-19 and to spread COVID-19. So while our children and young people may not show symptoms, they may not get as sick, they might not require hospitalization, they are able to spread that virus to their elderly neighbors, their grandparents, their parents, etc. And so while we do want to take extra precautions with our elderly, we really need to have a holistic perspective. All of your residents should be wearing masks. They should be practicing social distancing. They should be limiting activities, gathering with other people. And then there may be some extra assistance you need to provide to elderly. So in many jurisdictions, elderly may be asked to stay home. We also have things where senior citizens may not be getting the support they previously had. They may not be able to go to that senior center. They may not be able to have other options for social interaction. And so it's a good idea to be checking on your elderly residents. They may not be getting out, socializing, making sure that they have food that's being delivered to them. So I think the range of services to residents may be different, but the rules and the guidelines to lessen the transmission of the virus need to really be the same across all age groups.
Well, we're getting some questions in from our viewers now as I move on to Dr. Julio Figueroa. And the question is from the viewer is it safe to enter homes with known individuals in quarantine? Assuming that
they are in quarantine because they were exposed.
Yes. We'll go with that assumption.
Yeah, okay. So no interaction is perfectly 100% safe. I think that one of the things that has been very humbling about this virus is that its ability to transmit from one person to another and its ability to hide before that transmission occurs is pretty good. And so one of the things that we have in the hospital system have gotten to is always assume the patient has it until you know that they don't. And that means lots of testing. So if somebody is in quarantine, to me that means that they've been exposed and they are trying to keep themselves out of the population, in which case then I think you need to be maintaining precaution. If you're doing it because you're trying to go to see grandma and you're doing the 14-day thing and you haven't had any prior exposure and those sorts of things, maybe less of a risk, but certainly if you're in quarantine because you have been exposed, I would say that was a pretty decent risk event.
Ms. Cook, are there any regulatory standards or criteria for entering places where people are in quarantine?
The Department of Housing and Urban Development refers to, for all health-related questions, referring to the CDC guidance. So HUD has been very clear about not usurping its housing role with a public health with public health guidance. So, so any decisions as far as protecting health and safety come from the public health side, the CDC guidance, rather than HUD saying you can do something or not. And so when property managers are comparing what's working and what are best practices, a lot of that is recommendations peer-to-peer, because there are not a lot of clear guidelines, and particularly not a lot of regulatory guidance. Although the CDC did get involved in issuing an eviction moratorium on September 4th to prevent homelessness, which could end up furthering the spread of COVID-19.
Now, Ms. Babcock.
I was going to say, if you don't mind me jumping in.
Not at all. And for future reference, feel free to chime in anytime that a subject comes up that you want to speak to.
Great. So one of the things I hear a lot as a local public health official, and the questions I get a lot of calls of, I've been exposed, or I've been told to quarantine, or someone's in isolation. And I just, if for a moment, want to kind of explain those terms. And then also some questions I would ask if someone told me they were in quarantine. So one, public health and medical experts refer to quarantine as someone who has been exposed directly to someone symptomatic, but they themselves do not have symptoms and they have not tested positive. If someone has tested positive, and they're staying home, we then refer to it as isolation. Just so if Dr. Figueroa and I are using those terms, that's what that means. The other thing is, because these terms get confused, just as Dr. Figueroa explained, someone may have actually been exposed, or they might just be preemptively staying home because they're about to go on a trip. So there's a few questions to ask someone. For example, have you been tested for COVID? Have you gotten those test results? Were they positive? Have you gotten a positive test result? How long ago was that, right? Was it 3 months ago, or was it 2 days ago? Those are very different things. The other thing is, if you were exposed, what I am asking as a public health official is, was I exposed to Dr. Figueroa because we're sitting in the same room, or was it that Dr. Figueroa's spouse or partner had COVID? I was never with Dr. Figueroa's partner, right? So you can't be exposed, like there's not multiple chains of exposure, if that makes sense. So I know that gets really technical, but every health department across the country has contact tracers and people who are experts. And so there should be a generic phone number that you can call and talk through this with someone, so that you can figure out what exposure level you may have, and you may be able to determine. A resident told me that they're in quarantine, but they have this plumbing issue, in their apartment. Can I go in? That may need to be a conversation with the resident to get a little more information. And also, it doesn't hurt to, reach out to your local health department to talk through that exposure
now that you
level.
mention that, should there be a standard practice for a tenant who calls up and says, my bathroom has some plumbing issues? Should the tenants then be required to, just as a matter of safety, leave the apartment while the residents or the house, while the maintenance person comes in to attend to the problem?
I think that would be the best practice. One is for the apartment manager or maintenance person to ask, have you been sick? Do you have a fever? Have you tested positive for COVID? You should probably, if someone has been exposed or tested positive, you should, also determine whether or not the plumbing problem is an emergency versus air vents need to be cleaned, or what is the urgency of the maintenance problem. And then yes, if they're able to safely leave the home while you go in and do maintenance, that is probably a best practice. We know that not every resident may be able to leave the home at that time, but making sure the resident and the maintenance worker are not in the same room, for example, would be another best practice.
So
Yep, and I'll chime in there too. If they're not able to leave because they're in isolation or for some other reason, that if the resident can go into a room and close the door and windows be opened, airflow is real important. So if windows can be opened and then there's a closed door, that is optimum. And the whole is it an emergency or not? And some property managers have even found a way for minor repairs to help, and so wouldn't be plumbing, but maybe it's replacing a battery and a smoke detector using a video chat function of safely providing a battery or whatever, and then talking through the installation. So there is a gamut of what we'll call common sense best practices, but it all starts with the questionnaire, whether you're getting a cable guy coming to your place or a refrigerator or any other kind of service. Everybody's asking these days the basic health questions that were just shared, and ascertaining the need for the visit, and then kind of a decision tree from that.
What about I'm an apartment complex owner, and I want to show my property for a potential client? What are there regulatory things that I need to do to position myself for that?
There are standard requirements for working through the HUD voucher system or through other wait lists and accepting new residents. HUD is encouraging new residents to continue to be accepted during this time frame, but through any use of technology that can limit human interaction. So most of that guidance is laid out in the frequently asked questions document that I shared that HUD has issued. It's on their website, it's on the LAHMA website, and it comes down to trying to conduct business just like we all are, whether you're in a grocery store or you're applying for and entering an apartment. Masks, social distancing, gloves if needed, and conducting everything by technology when and where you can.
Thank you. I'm curious, just as an individual who goes to church, and on a Sunday we've opened our church up, and this is the third Sunday coming, and we've got this protocol where you walk in and you automatically get your temperature taken. Is that so? My temperature is normal. Does that mean I don't have COVID? Or?
Absolutely not.
Really?
Temperature is obviously, if you have a fever and you have symptoms, then the likelihood of you having the virus is going to be higher. But plenty of people are asymptomatic, completely asymptomatic, or they may be symptomatic but they don't have a fever. And so therefore the lack of fever does not rule out the infection with the virus at all.
So just because I have this temperature gauge and you enter my resident and I'm taking your temperature and it's normal, you're not wearing a mask, so it's totally meaningless, is what you're saying?
I would say that it's less meaningful than is probably out there in the public. I think that it's something that we want to do. It gives us a sense of being able to measure something. The other thing that's probably more important is ask the questions about symptoms, because the symptoms are probably more important than the fever per se. But even with that, because of asymptomatic carriage or pre-symptomatic carriage or expression of the virus into the environment, those measures are really not as protective as they were once thought to be.
Let's take another question from a viewer, and I encourage all the viewers listening to submit your questions, and I will pass them on to our experts. This is the second question. Is it safe for some of the elderly or anyone who has never contracted the virus to be together? Who would like to weigh in on that?
I can take a stab at this. So first of all, no one, I would venture to say no one really knows whether they have not had COVID at this point in time. If you've had COVID, you know, but if you haven't had COVID, you don't necessarily know that, because so many people can have this virus without any symptoms. And what we now know is that Many people had COVID before there were tests available, in those early spring months when we just didn't realize that it was spreading around our country. And so that is the first piece. And really where we are seeing the spread of COVID-19 right now in our country is between families, friends, and neighbors. It is not right now, because of all the protective measures, this is not happening at concerts, at large events, those things. Even your church, for example, is probably spacing people out pretty far. You're in the grocery store, you don't know people, so you're wearing your mask. But it's when your cousin comes over, your brother comes over, you're in the backyard, you know each other, you don't have COVID. Clearly, my next door neighbor doesn't have COVID. I see them every day. I see them wearing their mask. And so we feel really comfortable, so we take our masks off. It starts to rain, so now we move into the house, still not wearing masks. That's where the spread of COVID-19 is happening right now. And so we're really urging everyone, when you are with someone who does not live in your home or in your individual apartment, that you need to be wearing a mask. So, and obviously outside gatherings are going to be safer than inside ones. So if you do have a group of people, we know it's been 9 months since you've seen your grandmother, right? You may have had a baby that your family has not even met yet. These events, holidays are coming. Some of those gatherings are going to happen, but making sure we're doing it outside, we're doing it masked, and we're taking all the safety precautions is really important.
Ms. Cook, this question is coming to you, so stand by. And the question is, are we allowed to ask a resident if they have been exposed?
Technically, I don't know that you can ask direct health questions. I think you can ascertain from a safety that yes. So I'm not a lawyer, and this sounds like a question for a lawyer. But I would say that based on the questions that we've been talking about. You can ask if you're experiencing symptoms now, and I think you can ask if have you been exposed. You can't share that person's name with anybody else. That's for definitely. You can't share if you find out a resident has been exposed or one of your staff members have been exposed. You can't share that person's name with anybody. You can put up a notice saying there has been a case of COVID in the apartment building, and we encourage everybody to take precautions. You can't name names. But yeah, I do believe you can ascertain the basic questions that everybody else is talking about as far as, say I'm a maintenance person and I'm the property manager and I want to ascertain that the maintenance person can go in. I think you can ask those basic questions, but there needs to be certainly a level of commitment to privacy for the answers that are given.
Well, let's reverse the question. Suppose I'm an apartment manager, and one of my administrative assistants comes down with a case of COVID in the office. Am I required then to tell anybody who might be coming in looking for a place to rent or lease that this office has had an incident of COVID exposure?
So a best practice that I've heard from property management companies around the country is that once an exposure has happened in an office, that it is closed and given a deep clean based on guidance provided by EPA and CDC on what constitutes a deep clean. And then when it's reopened, it is safe to do so, and you wouldn't have to post the notice. It would be recommended that clean be conducted before other outside people would come in. So there is a remediation that can happen after somebody has been sick in the office.
So that doesn't, you're not relying on the regional protocol. That's a national requirement. Is that what you're saying?
I'm saying that on the CDC website, there's guidance on what protocols for cleaning hygienically that can ensure eradication, and the CDC lists some EPA products that are proven to kill the virus. Mm-hmm. And so that would be a natural approach, would be to clean an office or an apartment, mm-hmm. or what have you, where someone has been sick with COVID-19.
Dr. Figueroa, I think you started something with this temperature thing we were discussing. Yeah. The next question deals with that. It says, while we require face coverings to be worn if entering the office, should we be taking temperatures also in addition to wearing the face mask?
I mean, I think that if it would be more of a comfort level, I suppose, more than anything. So it's we do things to make people feel more comfortable. I'd say that if it's between taking temperatures or wearing a face mask all the time, I would take wearing the face mask all the time. Because in my experience, there have been plenty of people who have had COVID, actually active symptomatic COVID-19, who have been afebrile. So I think that the taking the temperature, if it makes your population feel a little bit better, but still insisting on mask wearing as much as possible, is the way I would go with that.
So would that be the general consensus right now among the experts that the mask is our best protection?
Yes, until there's a vaccine, the mask is definitely the best protection. Some of the other measures like temperature monitoring were put in place in the early days when we didn't know that you could be asymptomatic. So in the early days, the only COVID cases you knew about were the most extreme symptomatic, where many people had a fever. So that's why those were put in place. Over time, we've learned a lot more about this virus. The mask really is our best safety precaution. Things like cleaning surfaces and hand sanitizer are also good, but the vast majority of transmission happens when two people are in close proximity without masks, much less so when you touch a surface that has a virus and then, touch your face.
What if I'm not cleaning my mask every day, Dr. Figueroa?
So, I mean, certainly there could be environmental contamination over time with the mask, so it's good to have a clean mask as much as possible. I also want to perhaps you want to weigh in as well about the type of mask, because I think there's a lot of confusion about that part as well. We in the hospital use surgical masks or maybe N95 masks. And there's been encouragement by CDC to do cloth masks, but there's a certain way that those things have to be put together in order to give you the maximum protection. So, so from the standpoint of masking, and it's just maintaining sort of cleanliness in the environment as much as possible, and understanding where you've touched and where other things have touched, and that you're not touching your face, unless you've cleaned your hands, and that when you put your mask down, it's basically an extension of you, and that is also potentially a contaminated space. Now, the length of time that the virus actually stays on surfaces has been studied, and it can be hours to days. Whether or not there's a major component of transmission based upon that versus what was mentioned earlier about close proximity, aerosol, droplets, transmission, I think the way it's going to be more the face-to-face.
We have a very astute audience, by the way. They're asking some great questions. Great. So we're going to delve into those questions, because this is all about you out there.
Can I just make a comment about the mask?
Go right ahead.
Yeah. So I would just say, if you're wearing a surgical mask or an N95, those are one-time masks. One-time mask. So you should wear it at the end of that day, throw it away. Some, like you've got the surgical mask.
This mask is a one-time mask?
Yes.
Okay.
So this is what I'm wearing today, double layer cotton mask. When I get home, I throw this in the washing machine with the rest of my clothes. I have, 7 So every day, I put on a clean mask. And technically, it's difficult when you're wearing a mask all day long, but really the best practice would be to, if you're taking it on and off, use some hand sanitizer or wash your hands before taking it on and off when you're not wearing it. So you go out to eat, you want to put it in a clean Ziploc bag, not the same Ziploc bag. If you're using Ziploc bags, you got to wash that at home too, right? So even, we talked about my son is in kindergarten. So every day in his backpack, he has a clean Ziploc bag and a dirty one, and they're labeled, so when they change their masks out, they actually put on a new one and put it in the dirty bag. And there's a lot of information on the CDC website about best practices.
All right, guys, keep those questions coming in. I promise to shut my yap. I'm only going to ask your questions going forward. This next question is, would it be a good practice to wear paper safety suits in all homes as a precaution? Who wants to take that one?
It's not going to hurt you, but you may not have the budget to maintain that.
Because you'll have to keep changing that suit.
You've got to keep changing that suit. So you're going to go through an awful lot of suits that may be overkill. Now, someone is COVID positive and they can't leave their apartment and you've got to go in and do some emergency maintenance, I would save that suit for that sort of circumstance.
Right. Anything to add to that?
Well, that's what we do in the hospital. That's what we do in the hospital. In a COVID positive room, we wear an isolation gown to cover our clothes, and we take it off when we leave. So I think that's a reasonable step. I mean, I think the major thing to keep in mind is again, hand washing and making sure that you know what's contaminated and what's not contaminated is one of the things to keep in mind. And that's sometimes hard when you're kind of doing your stuff and you're forgetting kind of what actually happened. But being careful about that is very important.
Ms. Cook, we don't want to leave you out. What about providing safety suits for maintenance workers around apartment complexes?
So it was a great observation about cost. I think the key thing is, and properties are doing this, is providing the basic PPE, that protective equipment, such as the portable hand sanitizers, the masks, and gloves, and that the suits would be based on emergency maintenance needs. When you have to go into an apartment and the resident can't either come out of the apartment or close themselves away. But certainly in the affordable rental property system, there's not a lot of extra budget to provide for all these new things. Now, fortunately, HUD did provide some extra operating funds for providing PPE to property managers to conduct their work under the CARES Act, but that was for a finite time. And going forward, finding ways to keep staff safe and provide the equipment they need is you definitely need to provide the key stuff, and then look where the extra means, such as suits, would be needed for the expense.
Mm-hmm. There's one other thing I want to emphasize. So if you're going for bang for your buck, I think the mask, very critical. The other part that we haven't talked about yet is eye protection. So that in that sort of situation, the bare minimum would be good mask and eye protection in order to prevent most of the transmission. So that it's not necessarily on the clothes, but it's really in that aerosol, that droplet that then you're touching your face and your mouth and your eyes.
And then obviously the eye protection needs to be cleaned.
Yes.
Yes.
Absolutely.
So cleanliness is next to godliness.
Yes.
Yes.
All right. Next question is, when a child is e-learning schoolwork, will the maintenance man have to go into the apartment, and will the maintenance man or woman have to request the child to stop working on computer and leave the room? Who wants to tackle that question?
So I'll chime in that that if it's not an emergency, then everybody's schedule can be communicated and worked around before you just knock on the door and go in. So, for example, the resident contacts you and lets you know that there's something that needs to be fixed and it needs to be done sooner or later. The question can be who's in the apartment, and ascertain who's there, who can leave, how big an emergency is it like running water and it needs to be done now? But if it's not, then it could be fixed during either a lunch break or at 3 o'clock when classes end. So there's certainly a communication that should happen around the whole who's there, what's their health situation, what's the emergency, and ascertain the best and safest way to do that.
So I'm getting from your statement that the best way, and from all of you, by the way, the best thing to do is keep communicating. Keep communicating and asking questions. That's the best way to see yourself through this particular briar patch of an epidemic disease.
And I think that's, the child working from home is are they working at home because the entire school is doing virtual learning, or is it because that child is tested positive for COVID or under isolation, which then goes back to our previous conversation. And so, if someone has a concern about the learning environment, again, working on, does this have to be done right now? Can it wait until, after school ends? What if it can't, what room are they in? What's the exposure level?
I get the feeling that our viewers are taking notes on this discussion. This question specifically puts me in the mind of that. It says, in the leasing office, what happens if a person enters the office and is coughing? Will the personnel have to stop working for an amount of time and have the office fumigated? You want to try that first, Ms. Cook?
So, first of all, we'll hope that the person who walked into the office has a mask on. And then, so the and I do believe that any business can say mask required. So I would have a sign outside my office saying mask required. We've heard on the news of people not always reacting well to those signs, but and it depends on what local requirements are. Some localities require everyone outside of their home to wear a mask. So I would have the sign there, and then so you can't. While the medical certainly agree that you would presume everybody has might be sick, you can't presume when somebody walks in and coughs that it's not that you would treat them in less of a professional or a dignified way than it might be asthma or allergies or anything else. If they're so one of the ways you can deal with that is to have appointment times. Many offices are essentially closed and not walk-in. You set up appointments for people to come in. You have your mask on. You say you say on the sign or issue notices that discussions with meetings with the leasing manager or the on-site manager are by appointment only, and then you go through before the appointment. You go through the health ascertain questions, and so that you don't put yourself in that very awkward position where when somebody walks in, you treat them like they have, you treat them in a way that could be seen as less than not compliant with fair housing or other type of regulatory requirements.
Definitely something to consider. Anything to add to that?
I would just say, again, just because you are in a space with someone who has a cough does not mean you were just exposed to COVID. So you would, if that person later tested positive for COVID, they would work with contact tracers to determine what cleaning has to happen and also who would have to quarantine for the 14-day period.
Dr. Figueroa?
No, I think that's a good answer.
You think that's a good answer? All right, we'll go to the next question. We require that all residents wear a mask when they leave their apartment. Do we have any recourse if someone repeatedly refuses? I guess we'll have to start with the regulatory agency on that question. You're very popular today, Ms. Cook.
So just to clarify, I'm not a regulatory agency. I'm a nonprofit trade association, although we work with the regulatory agencies and we share their messages with our members. So my answers do not convey legal or federal government authority. So just wanted to clarify that.
All right.
The requirement to wear a mask can be if it's driven by state or local or county requirement, and you have non-compliance, then you can refer that person. You can refer the authorities to a problem at your website, at your property, and then it is however that local agency is implementing and mandating compliance, that would take it out of your hands as a property manager. If you are requiring it at your property and it's not required or mandated locally, then presumably you have made it, you have gone through the process to make it part of your house rules, which would have had to have been approved by HUD. And then if there's non-compliance with house rules, there's the whole body of HUD regulations about how you deal with residents who are not complying with house rules, which are part of your lease. So it's lease non-compliance. So it's more than just the sign on the wall. It's either mandated by a locality or it's part of your house rules if you want to have any kind of enforcement mechanism.
All right, Ms. Cook is not a regulatory agency, but she knows them.
I don't play them on TV.
Now, the second part of that question, Ms. Cook, is can we refuse service to persons coming into the rental office if they are not wearing a mask?
Yes, you can if, again, it meets the state or local requirements, or you have it posted as a sign to visitors. But the best practice I've heard from NAHMA members shared is that right now, especially with the virus raging again, is that you preclude putting yourself in those positions by having more of a controlled access. I just had a dentist appointment the other day. Their door's not open anymore. You go through your questions before you get there, and then when it's time, the door magically opens. And you're allowed to enter with the temperature check, which we all know doesn't mean anything. So you put in place the protocols that preclude the uncomfortable situations before they happen.
Sounds good. Mm-hmm. Next question: if the house or office has been vacated for at least 72 hours, is it safe, Ms. Babcock?
I might refer this to an infectious disease doctor, but we do know that the virus can live on surfaces for a few hours to days. I would refer what kind of the time frame is to Dr. Figueroa. Definitely, I think a week is a reasonable 72 hours. You might still want to do some cleaning.
Dr. Figueroa?
I would say that cleaning is going to be important, but it didn't have to be anything particularly special. Just cleaning the surfaces in a routine fashion using one of the EPA-approved products is going to be fine.
So the 72 hours, that's a good time frame?
It should be a reasonable time frame as long as you do the cleaning. That's the major thing is you can't just go in. I mean, you're going to have to clean it as you would probably ordinarily anyway. The other question is in terms of how long is the air, involved, and that's hours. That's not days. So that you can find aerosols that are positive for the virus in certain situations in the air for hours, which is the concern, especially in the hospital, which is why they're in special places, etc. But days, that's not been described.
So what if I just open up a whole bunch of windows and doors?
I think that the ventilation is absolutely key.
All right. And the next question: if someone doesn't have a mask on when entering the office, and you have one on, will I be okay?
The answer is you'll be better than if you weren't wearing it, but you're not completely out of the woods.
I'm not completely out of the woods. Why not?
Well, for two reasons. One is that that individual is still, assuming that they have SARS-CoV-2, that individual is still producing respiratory droplets and aerosols potentially that could go through your mask. I mean, not all the masks are airtight, et cetera. So if you're wearing one of these N95 masks or something of that nature, then you'd be better protected than if you're wearing a cloth mask, for example, or a surgical mask. The second part is the eye protection, so that the mucous membranes are all potential for transmission, and so the eyes, the conjunctiva, the lining of the eyes is also there as well. So it definitely reduces the risk, but it doesn't eliminate the risk.
We're not pushing this eye thing enough, are we? Because I mean, we're talking about the mask, and we're talking about we're prolific in terms of our discussions about masks, but the eye thing, I don't think we're so much pushing.
Yeah, so I mean, I think that there are some people in the infectious disease community who really push face masks. I mean, the eye protection as well, and clearly the face masks are more important. There's no doubt about that. But in the hospital setting or in closed settings, eye protection seems to be also important. So in the hospital, for example, as you're looking at healthcare worker risk, if the healthcare worker and the patient are wearing masks and the healthcare worker has eye protection, that individual is thought to have a much lower risk encounter, even if the patient turns out to be positive, than if they didn't wear eye protection, for example.
So we also talk about our masks don't just protect me, but they protect you. So if you and I are having a conversation and we're both wearing masks, the eye protection is a little less mandatory because I've got my mask on, so my germs are essentially staying closer to my body, right? Yes. Just like yours are for you. And definitely we do see this eye protection, heavily in healthcare settings. So there are some days that I have to go into hospitals or I'm at community-based testing sites. And so in addition, one, I would not wear a cloth mask in those settings. I would sort of upgrade that to a surgical or N95 mask and do either a face shield or full eye protection depending on the setting. And so a mask is also when we talked about budgets, right, with our Tyvek suits as well. Eye protection is similar, right? So our mask is the highest level of protection, or the thing that's going to kind of make the biggest difference. And so for most people, that is in a population where there's limited transmission of COVID, that may be okay. When you're in a higher risk setting, you're going to visit grandma in a nursing home, you're going on an airplane where people are closer together, things like that, you may, or you're going into an apartment where someone has COVID-19, that's when eye protection becomes really necessary and cost effective.
We're getting some really great questions, and we thank you for them, and we encourage you to continue to submit your questions, and I will relay them to the panel. Next question. If a person has COVID, is there a time frame before a test will show positive, or will it show immediately? Who wants to tackle that?
I guess the question is what the definition of having COVID is.
Okay.
So as an example, I just acquired the virus just now.
Okay.
I will not test positive now. I will not test positive tomorrow. I might start testing positive the next day, and then you're going to be averaging positivity rates peaking around 5 to 7 days-ish. Depends on the study and the assay. So that is not immediately that you're going to be testing positive. It also is not immediately that I'm now contagious to other people. The virus has to kind of develop and set up shop for me to then have it in my respiratory secretions to transmit to the next person.
All right, you want to add to that, or?
Well, I think where this comes into play is people ask, I just got exposed, so now can I go get a test right now? People think that the public health department just called me and said, I've been exposed, I have to quarantine for 14 days. Can I run out and get a test, be negative, and go on with my life instead of the 14-day quarantine period? And the answer is no. Just because you tested negative for COVID today does not mean you're not going to test positive tomorrow or in the next 14 days.
Ms. Cook, this question is coming to you with love in its heart. The question is, What if someone refuses to wear a mask in office and has medical documentation that they are excluded from wearing it? Do we have the right to refuse services?
This is where fair housing would kick in, and you would have to set up a reasonable accommodation for that person's documented medical situation. And so you would work with that person to ascertain or help them with whatever they need, whether it's virtually by Zoom or FaceTime or whatever. And again, it goes back to my earlier suggestion for having protocol that doesn't put you in the spot at the moment with having to deal with something that has health implications that you could have easily precluded by having an appointment type based system or other a situation where you can have those conversations before you have a maskless person. But absolutely, you would need to work with a reasonable accommodation for addressing what they're requesting of you. If they have medical, just like any other kind of reasonable accommodation from a special need or disability that precludes being able to comply with some requirements.
Interesting. Our mailbox, this is the next question. Our mailbox area is located inside the same building with the rental office. The rental office is always locked. How do we avoid the entrance of residents that enter the building without a mask to retrieve their mail? Who wants to tackle that question?
So would it be too flip to say move the mailbox?
I don't think this panel could be too flipped. I think that might be. A reasonable solution to just move that. I mean, we just finished having a discussion about communicating, and asking questions about, how we would make things safer, right? So
yeah, if you can move the mailbox outside, that would be the best.
That's even better, right? All right, next question. How often should we sanitize the area of the office where visitors come in? Who wants to tackle that one?
Well, I mean, I can tell you that in the hospitals, they have a routine schedule, which is, daily or Q shift, cleaning of the environment. So there's nothing like enhanced cleaning unless there's an exposure. So if someone is in a COVID-19 room, then those surfaces are cleaned on a regular basis. But in the general common area, the cleaning in the hospital is the same per protocol and is on a Q shift or Q day basis.
So, Ms. Babcock, if the maintenance man is coming in and out, I'm naturally cleaning up after he leaves, right?
Yeah, I think especially if there's shared workspaces. So, if you maybe have a few different staff who are sharing a desk, for example, you might want to leave, disinfectant wipes there on the desk. And so I come in for my shift. I'm going to clean everything down, clean the keyboard, clean the phone, clean the desk. And then you really want to focus on your high touch areas. So the doorknobs coming in and out. You could also do things like put hand sanitizer right outside the door so that we're sanitizing our hands before we touch that doorknob, which would help limit. But I think on those high touch surfaces, you definitely want to be doing it once a day.
What about spraying yourself down with Lysol?
Yourself or the surfaces?
The surfaces.
Yeah, I think spraying things down with Lysol does not hurt. So, for example, in our health department, in my office that only I am in, it's more about disinfectant wipes, but when have a few people who are done in the conference room, then we might go in and spray down the conference room surfaces as well.
Our viewers are definitely paying attention. This next question about eye protection. Would goggles work better than the eye shields that look like glasses?
So what I would say is the goggles that go the whole way around and suction to your face are going to be the best source, and then probably the ones that look like glasses, and then the face shields which are further out. But it's really about how the air is able to circulate around your eyes.
It's fair enough.
You concur?
Yeah.
All right. Next question. Are the face shields protective if wearing alone without a mask?
So the preference would be to wear the mask with the face shield if you're going to do that. Initially, there was some information looking at just using face shields as opposed to masks. I think the data there are not that good. So therefore, both, if you're going to use them, use both. If you're going to choose one, choose the mask.
Choose the mask.
Yeah.
All right.
I will say face shields are probably a good alternative for someone who does have breathing problems or is on oxygen and may not be able to
So
wear.
a case can be made for people with breathing problems.
Yeah, I think that's okay, but again, I mean, the purpose of the face shield in that scenario is to protect the individual, not necessarily to protect others. So underneath the face shield, all the things that are coming out of that individual are contaminating the environment and the air. So therefore, that's the major thing with the using the mask, is it contains the secretions.
But the face shield does not contain your
That's right.
Correct.
secretion.
That's
All
right. And certainly the goggles wouldn't do that.
Yeah. Next question is, can you get a true positive if the swab is not entered deep enough?
So in other words, a nasal specimen versus a nasopharyngeal specimen. So some of the tests are approved for nasal specimens. The sensitivity of those tests are not as good as the ones that do the nasopharyngeal specimen, and also some of the antigen tests are nose versus the nasopharyngeal. So the answer is yes, you can have a true positive with that, and one of the nucleic acid amplification tests actually does the nasal swab. That's the one that's used in the White House and several other places around the country. So that the nasopharyngeal specimen is thought to be a better specimen, but is not the only specimen.
Yeah, there's a lot of different types of tests, right? Antigen, antibody, PCR. It can be extremely confusing for people, but probably the nasal, pharyngeal swabs are going to be your best option. And if you're getting an antigen test, you test positive, you should follow up with a PCR test as well. Some of your health department may be able to direct you to which test you have locally and kind of what your options are.
All right. Here's our next question from our viewers. Should someone who has tested positive for the virus get tested again after the 14 days to make sure that they are still not infected? Are there any regulatory requirements that pertain to that, Ms. Cook?
So I would consider that more of a health-based question. For example, if you've tested positive, when do you become non-contagious? So that I would see that more as a health-based question.
Oh, then we'll move on to Dr. Figueroa.
So the current guidance from CDC is to use a time-based discontinuation of isolation. So that if someone doesn't have a lot of symptoms, or certainly if they're not admitted to the hospital and they test positive, then you use the start of symptoms or the test positive and go 10 days, and then after that you are considered no longer contagious. The test can be still positive because that's virus that is either dead or is not able to be transmitted. So the situation where it gets longer is in individuals who are very sick, in other words, got into the hospital, or are immunosuppressed for some reason because they're on steroids or some other drug that would decrease their ability to handle the virus. There, it's 20 days. And then on a case-by-case basis, it may be longer depending upon the situation, but those are a consultation type of thing. So we now are doing 10 days and 20 days.
Anything to add to that?
No, there are a few places where you do have to do a test negative, but those are mainly in nursing home patients that we don't want coming back into that high-risk setting without negative test results. And so the time frame is easier for people, and in places where testing is difficult to get, the time frame is just generally easier for everyone.
All right, let's move on to the next question, which is, Is it safe for maintenance to use Lysol if he has to spend more, or she has to spend more than 15 minutes in a unit? You want to tackle that, Ms. Cook, or should I move on to the infectious disease?
So when you say use Lysol, I assume you mean spraying it on a surface, or do you mean spraying it in the air? So if that's product usage questions, and certainly we want all of our maintenance people to be reading the guidance. All the products that are approved by the EPA are required to have their usage requirements and directions for use, and so all directions for use should be read and followed. And so I would say that should be the standard that any property management company should have, is that know what products you're using and follow the directions for use. And other than that, it wouldn't be appropriate to give any, I don't think, any particular
Any good,
more specific
yeah,
and follow directions on the can.
I got you. This thing in my household, for instance, we're just we're slaves to Lysol. We want to Lysol everything. When the grandkids come in,
You did it. That's great.
when the grandkids come in, we want to Lysol them down. I mean, are we being just overly zealous with this Lysol issue?
I think it's
we're not trying to. We're not trying to endorse a product.
Sure, no,
it's just like.
I understand. What I would say is that maintaining the as much hygiene as possible is certainly something that's important, and I think working it out in your particular situation and what makes sense is going to be important. Again, sort of surfaces seem to be less important than the droplets and the aerosols.
Well, this thing about making sure that we're all protected. I mean, we all seem to be obsessed with that, and rightfully so. I mean, that's top of mind, especially when you're talking about a disease that is deadly. So, which brings to mind this question. As we know, restaurants are required to have patrons sign in for contact tracing purposes. Should we adopt that procedure in our administrative offices?
So I think this goes back to Ms. Cook's point. When you have an appointment-based system, you probably already have a schedule where you would have someone's name and phone number. And that way, if someone in your office tested positive for COVID, you've now made contact with your local health department contact tracing team, you would be able to let them know who has come in contact with that employee. So that appointment system would be useful in that circumstance.
Dr. Figueroa?
Yeah, I think that's an excellent answer. I mean, the thing about restaurants or in other, like churches, for example, is another situation where you may not know necessarily everybody that's in there. So when the contact tracer calls you, says, or you've been contacted that you're positive for COVID, and then trying to figure out all your different contacts. I mean, that may be where it's more likely to be involved, and having that list is important.
Well, Ms. Cook, this question will come to you first. Should common areas such as laundry rooms, mail rooms, and community rooms have signage limiting the number of persons at a given time? And should masks be required and signage so indicated?
I would say yes, absolutely.
That's so. I'm protected if I'm making those requirements and I'm not violating any kind of federal regulations in terms of discriminatory practices.
So as a property manager, your responsibilities are to provide safe, quality housing. And during a pandemic, you can actually, during the height in the summer, a lot of properties didn't even reopen their pools, as an example, or close down their playgrounds, as an example. So as long as you're applying the restrictions to all people and not any particular class or gender or age, and that so in other words, you can't say no children are allowed in the laundry room, and your requirements are following reasonable local guidance, that you're certainly putting up a sign is the appropriate and safe thing to do for your property.
What do you weigh in on that, Ms. Babcock?
Yes, I think that is a good best practice to have those areas, and probably your local health department or some jurisdiction has probably set out guidelines for the number of people per square footage. So here in Louisiana, the state fire marshal, depending on what phase of reopening, which is based on the amount of transmission within the state, has specific square footage per person. So you would be able to look at those guidelines so that you can measure that laundry room, for example, and determine how many people should be in there at a time.
So does the city have the same requirements as the state, or?
Yes, in New Orleans we do have some measures that are a little more restrictive, but in terms of square footage, we are following the state fire marshal.
All right. We have another question. It says, we have sanitation stations set up at our office, masks required and plexiglass. So should we be doing more? They've got sanitation stations set up, masks required and plexiglass. Is there anything more that they should be doing?
That is probably a reasonable amount of work. Again, having appointments or limiting the number of people that are in the office at any given time would also be helpful.
And here's another question. Is there any effectiveness in using vitamin D? Can you think of any, Dr. Figueroa?
Vitamin D has been a vitamin supplement that has been in search of a reason to use it, unfortunately. There are a lot of case control studies and other sort of cohort studies that have shown that people with low vitamin Ds have all kinds of health outcomes that the assumption is that vitamin D supplementation would make a difference. And the answer is every single time it's been looked at, it's not worked. So what I would say is that I wouldn't rush out to get vitamin D at this point for this particular reason.
So just hold off on the vitamin D, and
I mean, if you're prescribed vitamin D by your healthcare professional because you have a reason, you know, like you've got osteoporosis or whatever it happens to be, that's a different story. But for this particular indication, no.
So where do we go from here? We are at a stage now where every region or every state, and sometimes every city, has its own set of regulations in terms of safety protocol and dealing with the pandemic. What are we looking for now? Are we looking for some kind of national protocol that's going to bring us all together under one umbrella as it relates to trying to deal with this unrelenting disease that looks like it's going to cause some areas of the country to go back into shutdown phase?
Yeah, I think we're looking for two things right now. One, you know, we are in a funny place in our political system, and so right now we're waiting for the next administration to take office, and so I think that there may be some changes when that occurs, which may lead to a national strategy. And the other thing we're waiting for is a vaccine. And so we're waiting for a vaccine. We're waiting to see how effective it is, how many doses you're going to need, you know, and not just effectiveness, but is it effective the same way for an elderly person as it is for a child? And I do want to warn people that most of the vaccines in the market, one, are going to take some time. It's going to take time to be approved, but then also some time to manufacture enough to vaccinate everyone, right? And most of these vaccines are going to need multiple doses. So the expectation should not be that I'm going to go to my doctor's office, I'm going to get my COVID vaccine and throw my masks in the trash. That's unlikely to happen. They'll have to be, you may have to get multiple doses in order for it to be effective. And then, you know, not every vaccine is 100% effective. So there may still be a period of time in which you need to wear masks and do these other protocols. The other thing is, you know, we are right now entering our flu season, and so far we are seeing pretty low rates of flu. Why? Because we're wearing masks, because we're sanitizing, all of these things that are not only helpful for COVID, but also for other viruses out there. And so a lot of these measures are good things that we need to remember and probably fold into our daily lives.
But what do you see going forward, Dr. Figueroa?
Well, I think that having experts look at the data, we've now 10 months in. Actually, if you count the Chinese experience, even more than that. A lot of the information is going out. I'll tell you that in March and April, when we were trying to figure out what to do, the amount of information that was out there was overwhelming. It was really, really tough to kind of sort of get your head around all the different data points that are out there about how to treat patients and how to prevent COVID transmission, all these other things. I think having individuals who know the science and be able to tell us in a very sort of detailed way, as was mentioned earlier, if your transmission rate is X, then these are the protocols that you need to do with schools, with rental housing, with mass gatherings, with restaurants, with whatever, and then have a lot of those protocols out there and evidence-based so that we can protect as many people as possible and yet have the economy open and not have this hodgepodge of rules and regulations based upon this locality versus that locality. I mean, I think that we have the ability to do a comprehensive plan that will take into account all the different vagaries of the local system, but that makes sense for a national strategy.
On to Ms. Cook now. We haven't forgotten about you. What about your perspective from the affordable housing point of view? How has this disease affected what you've been trying to accomplish, and what do you see going forward?
Well, I think that a couple of thoughts, and one being that communication is key, but also staying in touch with what's going on, because if we were having this conversation in June versus now, some of the answers might have been different, and they might be different again in December or January as the science becomes crystallized and as the type of vaccine becomes better known. So I think that unfortunately that provides a situation of uncertainty for folks. It's almost, human nature is give me an answer and then I know what the answer is and I can go on with my life. But the pandemic is not like that. We have to be able to keep questioning, stay alert, and adapt to what's known at the time. And that's challenging, but that's 2020. Mm-hmm. I would say one of the key things we've seen is that now more than ever, finding affordable rental housing is key, because the other side of the pandemic, in addition to the folks dealing with the health aspects, has been the economic crisis that has resulted from people losing their jobs and not being able to afford rent and food and basic necessities. So I think the need for affordable rental housing has been highlighted, and is only going to be even more important in the coming year or two. I think also that the challenge that the rental housing community has been under with the eviction moratoriums, we don't want people to be evicted during these times, but at the end of the day, rental providers need to be able to not only pay their own mortgages, but to pay staff and to do building upkeep and all the things that rent contributes toward. So Congress really needs to provide rental assistance to renters so that they can pay their rent, and that we don't have an economic collapse due to the pandemic. When we have the end of the moratorium and all this back rent is due, and folks will be unemployed, and so they won't be able to pay that. So there are some looming crises beyond just the dealing with the health aspect of it.
So from where you sit, Ms. Cook, is there light at the end of the tunnel here? I know there's been a tremendous setback for affordable housing because of the economics associated with COVID-19.
So I think the light is shining on the need, the great need for affordable rental housing. I think whenever a nation has multiple competing needs, that sometimes the hardest ones are the ones that are tackled last, because there aren't any easy solutions, and providing affordable rental housing across the country comes down to need not only for money resources, but also it gets into the weeds and localities with zoning and a whole bunch of challenges. But I think that one of the outcomes will be the spotlight on need, and that how important a place to live, a home, is to your basic health. And it seems obvious, but maybe it takes the spotlight of needing a home to quarantine in to really emphasize to people that, hey, you need the home part to be able to quarantine in a home. And so, we have to look for the limited silver linings that have been provided to us by COVID-19, but perhaps that's one.
Thank you for your insight, Ms. Cook. And as we are moving towards our closing time, Ms. Babcock and Dr. Figueroa, I want you to assess the silver lining, if there's any.
As Ms. Cook said, I think that COVID-19 has shone a light on a lot of the existing problems in our healthcare system, in our public health system, and particularly around health disparities and health inequities, particularly in communities of color. That suddenly the whole world can see the things that us as public health officials and as physicians have seen for many years through racial disparities, and really hoping that there is more federal funding and policy changes that can better improve health outcomes for all of our residents.
Dr. Figueroa?
Absolutely. That's one of the most important things that's come out of this, is someone who works with that population at University Medical Center and in other settings. I mean, I think the whole health disparity thing is really very evident here, and I think if we have some impetus to actually try to affect those things, that would be very good. The other thing I would mention is that the rapidity with which the scientific community has responded to this whole thing, from the isolation and the identification of the virus in the end of December to a vaccine that hopefully will be coming to market within the next month, that's all within a year. If you think about what happened with our last pandemic and the influenza of 2009, it took a lot longer than that to actually get to the vaccine widely available. So, I mean, I think that the other thing I think we should keep in mind is that our folks who are involved in public health and in the science have really sort of pushed the envelope in a way that is kind of gratifying to see.
I've really enjoyed this discussion with you guys. It's really been some compelling and insightful information, and I couldn't be more happy with this panel. I mean, you guys have really risen to the occasion. You've given us some positive information that we can take with us, and made us feel a little more comfortable about taking on this disease. So I want to thank Ms. Chris Cook from Washington, D.C., Dr. Julio Figueroa, and Ms. Sarah Babcock. And we would also like to thank all of you for watching today and giving us those wonderful questions. And thank you for joining us virtually for this Louisiana Affordable Housing Management Association seminar, COVID Awareness, Past and Future. I'm Norman Robinson. God bless. That didn't seem like an hour and a half, did it?